Every 40 seconds, someone in the United States suffers a stroke. Medical research shows that up to 43% of stroke patients experienced clear warning signs in the days and weeks leading up to the stroke, signs that are often mistakenly overlooked as minor issues. Today, we will examine 6 vital warning signs that appear weeks before a stroke. These are not vague signs but rather signals that your body scientifically records and sends when blood flow to the brain is disrupted. By the end of this video, you will be able to recognize these signs and understand when your body is asking for help, a topic that could prevent a life-changing medical emergency. Please note that this video is for informational purposes only and does not replace medical advice. All research has been reviewed, and sources are attached in the description. Mini-stroke or transient ischemic attack, TIA. This section is one of the most serious warnings. Imagine suddenly experiencing facial drooping on one side, weakness in your hand or arm, or difficulty speaking, but this condition resolves on its own within a short time, anywhere from a few minutes to a few hours. It's natural to think, there's no problem since it went away. However, the reality is different. These events, known as transient ischemic attacks or mini-strokes, are actually like a rehearsal for the main stroke. Official statistics from the American Heart Association indicate that about 43% of those who have experienced an ischemic stroke had one or more TIAs in the week leading up to it. In such cases, blood flow to certain parts of the brain is temporarily disrupted, causing symptoms similar to those of a stroke. When the blockage resolves, the symptoms quickly disappear. This temporary nature leads many to dismiss it as unimportant, while doctors consider TIA one of the most significant warning signs of an impending stroke. So, if you experience sudden weakness or numbness, blurred vision, or difficulty speaking, even if it resolves quickly, consider it a medical emergency. Sudden vision problems. One significant symptom that many people do not take seriously is sudden changes in vision. These changes can manifest as blurred vision, double vision, or even complete loss of vision in one eye. Many attribute this issue to fatigue or eye strain and dismiss it as unimportant, but in reality, your brain may be sending an emergency message. According to scientific reports, a significant percentage of individuals who have suffered a stroke experienced some form of sudden vision problem in the weeks leading up to it. Research has shown that these changes can last from a few minutes to several hours and then resolve on their own. Vision problems during a stroke typically occur because blood flow to the part of the brain responsible for processing vision is temporarily reduced or stopped. This disruption prevents the brain from processing visual signals correctly, leading to symptoms such as blurriness, double vision, or even temporary blindness. The reality is that such symptoms are often precursors to a more serious stroke. Doctors emphasize that if any sudden change in vision occurs, it should be considered an emergency situation. So, if you notice that your vision suddenly becomes blurry, you see double images, or one eye loses its ability to see for a while, do not take this sign lightly. Your brain is alerting you that there is a problem with blood flow, and a stroke may be on the way. Sudden and severe headache, thunderclap headache. A warning sign that is sometimes overlooked is the occurrence of a very severe and sudden headache. The pain peaks within a few seconds to a minute. This type of headache, known as a thunderclap headache, should be considered a warning of possible bleeding in the brain, such as a subarachnoid hemorrhage, SAH, and requires urgent evaluation. These sudden headaches are often accompanied by other symptoms such as nausea and vomiting, neck stiffness, decreased level of consciousness, or seizures, especially in hemorrhagic strokes. When such a combination of symptoms appears, the likelihood of bleeding inside or around the brain increases, and it should not be attributed to a simple headache or migraine. A large prospective study conducted in Canada involving 3,132 patients who presented to the emergency department with sudden headaches and rapidly escalating pain found that 240 patients, 7.7%, actually had a subarachnoid hemorrhage. Additionally, about 82% of the patients in that study reported that this was the worst headache of their lives. These results indicate that although SAH is less common than regular headaches, when a headache with the characteristics of sudden and very severe occurs, the risk of a life-threatening condition is significant enough to warrant immediate investigation. One of the warning signs of a stroke is a sudden drop in blood pressure or severe fatigue. Imagine suddenly feeling confused, experiencing blurred vision, weakness, or even extreme fatigue. especially when you move from a sitting or lying position to standing. This can be a sign of reduced blood flow to the brain, a condition that doctors refer to as orthostatic hypotension. When blood pressure drops suddenly, blood flow and oxygen supply to the brain decrease. The brain is very sensitive, and even this short-term reduction can lead to oxygen deprivation in nerve cells. In individuals whose cerebral arteries are already narrowed or damaged, this reduction in blood flow can produce stroke-like symptoms, such as weakness, numbness, blurred vision, or speech disturbances. This condition is known as a transient ischemic attack, TIA, and is, in fact, a serious warning before a real stroke occurs. Additionally, decreased blood flow can slow down blood movement in the cerebral arteries and increase the likelihood of clot formation and vessel obstruction, which can lead to an ischemic stroke. In some cases, a severe drop in blood pressure can exacerbate damage to weak blood vessels in the brain and increase the risk of brain hemorrhage. A large study from 2018 showed that individuals with orthostatic hypotension are twice as likely to experience an ischemic stroke compared to others. So, if you suddenly experience confusion, extreme fatigue, or severe weakness, even if these symptoms resolve quickly, take this situation seriously. Your brain is sounding an alarm. Difficulty in speaking. Speaking and communicating are vital parts of our daily lives. When you suddenly notice that your words are fragmented, unclear, or difficult to understand, your brain is actually sending a serious warning. Language and speech processing require precise coordination between several areas of the brain, so speech disturbances can be one of the earliest signs of developing neurological issues. Scientific studies have shown that speech disorders, such as dysarthria, can appear weeks before a stroke. These problems can sometimes be very subtle. For example, your words may suddenly become unclear even when you are not tired or anxious. Family members may notice that your speaking rate has slowed compared to normal or that you have difficulty finding the right words in conversation. Some individuals even struggle to understand others' speech, as if what others are saying sounds like an unknown language to them. This occurs because the brain's language centers, typically located in the left hemisphere, require adequate blood flow to function properly. When blood flow decreases in the days or weeks leading up to a stroke, these areas may intermittently malfunction. Broca's and Wernicke's areas, which are responsible for producing and comprehending speech, are particularly sensitive to changes in blood flow. Speech problems are especially significant compared to other symptoms like headaches or dizziness, as they almost always indicate a real brain disorder. If you notice difficulty in speaking, finding words, or understanding others, especially if these symptoms occur intermittently, consider this an urgent medical warning and take action immediately. Weakness or numbness on one side of the body. Imagine reaching for your phone and suddenly realizing that your hand feels weak and shaky, or when you wake up, one side of your face appears numb and unusual. This feeling of weakness or numbness on one side of the body is one of the most important early warning signs of a stroke. Research has shown that unilateral weakness or hemiparesis often appears as a precursor symptom several weeks before a stroke. This occurs because the motor and sensory areas of the brain cannot function fully and properly due to reduced blood flow, leading to impaired performance before a complete stroke occurs. The early symptoms may be very subtle. You might notice that the strength in one hand is less, or that one leg feels slightly heavier when climbing stairs. Some individuals experience intermittent numbness or tingling, medically referred to as paresthesia, in the face, hand, or foot. These sensations may come and go, and many people might think they are due to sleeping in an awkward position or minor injuries they don't remember. However, the important point is that weakness or numbness always occurs on one side of the body. This indicates that a specific part of the brain is not receiving enough blood. The motor and sensory cortex areas, which are responsible for movement and the sense of touch, are very sensitive to changes in blood flow. What makes this symptom critical is its progressive nature. Weakness that starts off mild but worsens over days or weeks indicates that the blood flow issue is getting worse and may lead to a complete stroke. A study published in 2023 in the Journal of Stroke and Cerebrovascular Diseases found that unilateral weakness or numbness, hemiparesis, is one of the most common warning signs of a stroke. In this study, 90% of patients reported experiencing this symptom before the stroke occurred. The study emphasizes the importance of early recognition of these symptoms to ensure timely medical interventions. If you found this video helpful, don't forget to like and leave a comment. Until next time, stay informed and healthy.